Hi everybody, and welcome to the Path Safe webinar series. We're just going to wait until a couple of minutes for everybody to finish joining us. I think I can see that quite a few people have joined us now, so I think I'll kick us off and everyone can kind of just join as and when. So welcome everybody to the Path Safe webinar series. Today we're joined by colleagues from around Europe who are delivering the Path Safe evaluation. So we're joined by Sana and Pamina. This presentation will provide an update on the evaluation to date and provide some interim findings on the evaluation as well. So following the presentation, there'll be a Q&A session, and I'll talk a little bit more about that in a second. So a few housekeeping elements before we begin. The session today is being recorded, and the slides will also be saved to the Pathway webpage in due course. The session is due to run for about an hour, so it should hopefully finish up about 2 p.m. Please can we ask that you keep your microphone on mute if you're not speaking. But as mentioned, we'll have a Q&A session later on after the presentation. So please use the Q&A function to post any questions that you have. And then when we come to the session later on, we'll ask you to unmute and ask a question to the group. And any questions that we don't get to or we can't answer them straight away, we'll follow up with them offline after the meeting as well. The chat function has been disabled for the webinar format. And a link to the Pathway webpage will be pinned in the Q&A section for your reference. So with that, I'll hand over to Sana and Pamina to start us off.
Great, thank you so much, Laura. So hi everyone, thank you for tuning in. Very happy to be talking to you all about the Pathway evaluation. And I think we've spoken to quite a few of you during the course of the evaluation as well. So just want to take a moment to say thank you very much for engaging. I think the more engagement we get, the better evidence we can present back and consolidate as well. So that's been really helpful. So thank you very much for doing that and taking out your time if you've done so. Just very quickly, I'll introduce myself. So I'm based around Europe. I'm a research leader working on emerging biotechnologies and AMR biosurveillance, amongst other things. RAND is a not-for-profit research organization. So we work quite closely with lots of government outfits and other not-for-profit organizations as well as industry to conduct research that can inform policy and guide decision-making. And we've been conducting this evaluation for the Pathway program commissioned by the FSA. So if we can move on to the next slide, please, Pamina. Thank you. So I guess it's just helpful to mention the wider ecosystem within which Pathway is couched. So I know it's a bit like preaching to the choir and you'll all be really familiar, but it's worth noting that the One Health ambitions for surveillance kind of revolve around things like having centralized and interoperable data sets across agriculture, environment, and the human health space. It also includes things like improved coordination among important actors across the ecosystem as well. So lots of different government departments working together. And it also requires enhancing surveillance capabilities to tackle infectious diseases and AMR. So PathSafe is couched within these broader One Health ambitions for surveillance as well. Next slide, please. So just very quickly, in case we have people joining in who are not that familiar with the program, but hopefully most people will be, the primary aim is for PatSafe to improve the tracking of foodborne pathogens and AMR in all 4 nations of the UK. And the way it's doing that is through a vast program of work, which is very comprehensive, looking across multiple mechanisms of surveillance, developing tools, frameworks, data platforms for interoperability of data sets, producing novel data sets, looking up various mechanisms of analyzing the data that's already to hand to spot trends and hotspots of infections as well. So it's a large-scale pilot, about £19.2 million for testing and developing these novel mechanisms and tools for surveillance capability improvement across the UK. Next slide, please. So, like I mentioned, we've been commissioned to do the evaluation of PathSafe, and the evaluation consists of 3 different distinct components. So, we'd like to try and demystify that a little bit, so when we get in touch with you, you know exactly what we're talking to you about as well. So the process evaluation really is what it says in the tin. It's focused on looking at processes surrounding the program. So it's looking at whether the processes that have underpinned the program design and governance and its implementations have been effective and appropriate for what it's meant to be doing, and whether the processes in themselves have acted as beneficial levers for change, or whether there are places where the processes have caused challenges to in terms of progress. So that's what the process evaluation has entailed. Then we have the outcome evaluation, which is currently ongoing, which is really about the so what. So you set up this novel framework. What does that mean? So you created all of these novel platforms. What does that mean? So the outcome is really about understanding what change has been facilitated or has been realized as a result of the program doing something. And then the impact feasibility assessment is the last component of the evaluation, which is really looking at how can we measure the long-term impacts that we've thought that the program will yield, and what will it take to achieve them, because we're still quite early on in terms of where the program's at right now. So that's what the feasibility assessment entails. Next slide, please. So I know this is a very scary slide, but I'll break it down, and I promise I won't go through all the small text on the screen. So this is, if you step back and kind of look at it as a holistic thing, it's a theory of change. And this is what we developed for PathSafe. It's one of the first things that we did with the team. And really what it's doing is it's theorizing or hypothesizing what we think the program is intending to do and how is going to bring about outcomes and impacts of the change that we anticipate the program to bring about. So it's basically a chain of events, looking across, you know, if you put in staff time, resources, and the activities that you undertake across the 4 work streams, what are the various outputs that will come out of that? What are the tangible deliverables? And as a result of those tangible deliverables, what are the changes that will be made? And then as a result of those changes, what are the long-term impacts in policy and infection tracking, for instance, that will be realized? So that's what the theory of change does. And the reason why it's so important is because this is what's underpinning our evaluation. So all of the evaluation questions have been driven from this theory of change to try and understand, are these activities happening? Are these outputs happening? Why or why not? How have they been designed from a process perspective? And then looking at understanding, are these outcomes emerging? When might they emerge? Because it's quite early on, we might be looking for indicators of progress towards outcomes rather than looking at evidence for outcomes actually being realized, and so on and so forth. So that's what the importance of the theory of change is. Yeah, you can go on to the next slide. That's fine. Thank you. So this is the evaluation timeline, just to kind of give you a sense of where we are. So early in the year, we developed the evaluation framework. which can be publicly accessed on the PathSafe website, which details the theory of change and the evaluation framework with the specific questions that we're looking to answer and the data sources that we're utilizing to develop the evaluation. We have just completed the interim process evaluation. We're still tidying up a few details with the central program management team. And we can talk a little bit about the emerging findings from that evaluation. And we've just kicked off the final process and outcome evaluation, which will run to until the end of the PASE program itself. And then after that, very shortly after that, we will come feasibility assessment as well. And that will be the last deliverable that we will submit for the program. So this is kind of where we're at in terms of the evaluation timeline. Next slide, please. So I'll talk a bit about the interim process evaluation that we've conducted, but I just have to caveat it with saying that it's a snapshot in time. So this was done earlier in the year. So a lot of the things might have moved on or might be slightly out of date. And we'll talk a little bit about that in the context of limitations. But it's important to bear that in mind. It's a snapshot in time. It's not the ultimate, this is it written in stone. So we're trying to capture things as they are in flight. So the primary methods and data sources that we've relied on for the interim process evaluation are things like conducting a documentary review, so reviewing all of the project briefs associated with the program, all of the variety of board papers and the highlight reports, and the various strategic papers that have been developed and associated with the program. So we've reviewed all of those. We've conducted some desk research looking at wider surveillance initiatives across the UK and internationally, especially in Europe as well, to look at similarities and differences and connectivity. And we've done interviews, which has been our main source of primary data, talking to the strategic stakeholders of the program, talking to the central program management team, as well as the delivery teams. So again, thank you for engaging with us on that and providing us your insights. And then we've taken all of that information and done a thematic analysis to see what are the main themes emerging across the questions that we've put forward, triangulated the evidence to ensure that we can be confident in what we're saying, and corroborated some of this with program management just to kind of ensure that what we have captured is in fact accurate and reflects the situation on the ground, and then develop recommendations for the wider community of interest. The limitations are a few. So it's quite a small group of stakeholders. That has created some challenges in assessing what is perhaps a perception held by a minority versus where there is a majority consensus. That's been sometimes challenging because it's been two people who've said something and then two people who've said something different. And so we've tried to present that in as measured a manner as possible without forming opinions on where there really isn't consensus. However, when you're talking about a small group of people, even if one person says something, it does hold quite a lot of weight. So those are the things we've had to kind of contend with and work through. And like I mentioned, rapidly unfolding activities across the program mean that there's a lag in the evaluation output. So findings do become dated quite quickly, especially in this interim phase, because things are moving on. And so we completed this analysis like in June, July, and then wrote up the report. So a lot has moved on since then, which we are sort of, well versed with. And again, because of the nature of the program, it's a pilot, data sources are quite limited. Things are still emerging, things are still developing. So for the first phase, we weren't able to directly engage with some of the end users because it felt like that wasn't the right time to be able to do so. So the data sources are quite limited as well. So we will look to diversify the data sources in the next phase of the evaluation as well. So these are just some things to bear in mind on methods and analysis techniques and the limitations of the evaluation in this interim stage. Next slide, please. So a snapshot of findings. These are really high level. We do have a report underpinning this, and some aspects of this report will be shared shortly by the team and, for wider consumption as well. But at a very high level, there are some very positive contributions and step change in surveillance that have been evidenced in the evaluation. So from the perspective of design and governance, it has been found that the resourcing for the program and the fluid allocation across the work streams has been really beneficial in catalyzing progress and efficiency in a way that has been helpful. The central program management team has facilitated a lot of networking and connections across the program, which has been seen as a real benefit of the program. And the governance mechanisms and forums that are in place to support knowledge exchange and to monitor progress, to see how things are progressing across the program, have been deemed to be appropriate. There are, of course, a few points for learning and reflection with all of these things, which I will talk about in a moment. But these are the things that have worked really well and have been shown to be promising and positive governance perspective, looking at the process. Then looking at surveillance activities themselves, the data platform development, looking at interoperability and connectivity assessments, evidence suggests that the processes that are being undertaken to do all of that have been quite helpful and relevant and engaged with users, which I'll talk about a bit more in a moment. There has been comprehensive multi-location sampling and sequencing, and over 80% of the targets for sampling have been met. There are instances of machine learning algorithms that are being deployed on data sets for predictive risk assessments, both for novel data capture and for existing data, which is yielding new insights on data that wasn't utilized before. And then there's a technology readiness level-based identification and prioritization that has occurred for remote sampling and diagnostics, so that they can be a couple of the prioritized technologies can be tested in the field. And the TRL processes that have been undertaken, again, have been modified and adapted to the needs of the program itself. So these are all really positive and novel things that have happened across the program in terms of surveillance activities themselves. Next slide. Then there's the end user and wider engagement and alignment piece. So across that, we have evidence to suggest that there has been a lot of comprehensive mechanisms that have been deployed for engaging multiple users across the appropriate work streams to make sure that the work that's being planned in the work streams does actually meet the requirements of these end users, the people who are going to be using and engaging with data and technology on the ground. Does it actually serve the purpose for them? There is also a lot of positive alignment with key government priorities and strategies. So PathSafe has been a critical lever in the Antimicrobial Resistance National Action Plan. It's engaging intimately with the National Biosurveillance Network to ensure that there's alignment and sharing of learning across the board. And it's it's been mentioned as part of the UK Biological Security Strategy as well, and aligns with the One Health ambitions, as mentioned earlier. So there's a lot of strategic alignment across the board. There's various community of interest and advisory groups that have been established. And so there feels like there've been a lot of momentum across bringing sort of very different stakeholders together, talking about key challenges and areas of learning across the biosurveillance space. There have been engagement with industry and multiple four-nation initiatives and networks that already exist. So that's really there to leverage existing knowledge and information and infrastructure that's there instead of reinventing the wheel. And that's been kind of leveraged and utilized in the program as well. And there's been expansive engagement across multiple government departments from AXA, DEFRA, FSS, FSA, EA, just to mention a few. I think lastly, and very importantly, PathSafe has been shown to represent a very kind of comprehensive program of work in that it works across the entire surveillance value chain. So what I mean by value chain is that, it's not just looking at interoperability of data sets, or it's not just looking at a sequencing methodology. It's actually looking from data to systems to multi-location sampling to then techniques to leveraging more value from that data using algorithms and predictive assessments to sharing that data. So it's kind of and to remote diagnostics. So it kind of covers all of the different facets of surveillance in one way or another, which is quite different to what we've seen in other initiatives in the sector. Next slide, please. So as with any pilot, there's of course teething issues. There's also always room for learning and room for improvement. So some of the things that we've noticed around sort of engagement is that there has been varied engagement across the work streams, which has been primarily driven by individuals from the bottom up rather than systematically or strategically. And that perhaps is to be expected given the varied nature across the work streams to some degree. There's also evidence to suggest that the participants in the various boards and advisory groups are perhaps not as fully engaged in discussions as is expected at times. There's also evidence around industry and academic engagement that we mentioned earlier and how fruitful that's been. However, again, that's been ad hoc and bottom up. So what I mean by that is that it's been driven by niche areas of work within components of work packages and work streams, rather than kind of at a program level, kind of more strategic and systematic engagement at that level. There's also evidence to suggest that there's limited utilization of some of the communities of interest, and that's likely due to the broad remit. Of course, the purpose is not to have a formal mandate, but sometimes those things can also mean that there isn't as much structure or as much utilization of these forums. And sometimes it's also, there is some evidence to suggest that milestones and delivery-centric discussions could be disproportionate at times where there's felt to be a more management-heavy focus, and the conversations could be more about the subject matter as well. So there's been a little bit of discussion and evidence presented around how that's been the case, and that's likely been due to the difference in cultures between a research grant versus a program grant and reporting to HMT as well. So there's some kind of undertones of cultural differences and expectations as well. Then there's, of course, data challenges. Now, data challenges are pervasive in a systematic issue, or a systemic issue, rather. These do persist. And so what we've noted is that there's variable agreements on data sharing across various government departments and work streams. Some work streams actually have been able to glean further data as a result of the program. However, largely this is an unresolved issue which continues to be worked on. There's also variable data capture and metadata capture, which has created challenges in bringing things together and sharing. And there's a challenge around commercial sensitivities and wider data sharing, and whether data sharing could compromise commercial information of industries and farms, etc., as well as being able to track back information to them. There's also been GDPR concerns on clinical data sharing. So I have to say that a lot of these things hopefully won't be new for people involved in the program. These are things that are to some degree already being worked on, and people are quite aware of these challenges. So like I said, these are some areas that are there for learning to take place and for improvements to occur. And then with that in mind, so if we move to the next slide, which is one of the last slides, we formulated some recommendations. Now, again, these recommendations are not just for the PadSafe program, but for the wider surveillance community, as well as for central government departments, because, things like funding and procurement flexibility are not within the gift of PadSafe, but these are things that could have helped the program kick off more efficiently, more effectively, with a bit more time, and being able to utilize a bit more of the budget that was allocated as well. So we've put forward some recommendations on how some of these things can be improved upon, some for the future of PadSafe and some for other programs of a similar nature. So we've put forward recommendations around funding procurement flexibility and what that could look like, having more of a focus on a more innovation and disruption focused agenda around reporting and discussions that take place, to kind of move away from milestones to actually talk more about innovation and what's happening in the sector and how can we be disruptive. There's also recommendations around aggregating outputs to feed into wider surveillance capabilities. A lot of what's being done in PadSafe will actually be very useful for the wider surveillance sector as well. And there needs to be some mechanism of aggregating the outputs in a way that can feed into those wider discussions and strategies and action plans as well. We've also provided some recommendations around having champions for community engagement and policy impact. There are a lot of key people working in the PadSafe community, and I think a lot of them could be utilized for championing some of the work that's been done and creating more interconnectivity between PadSafe and other areas of work as well. On a similar vein, more stuff around cross-sector knowledge exchange, including more strategic engagement with industry and international networks can be beneficial. Some of this was out of scope for PadSafe, but again, looking from a more future-focused lens, these are things that could be really helpful and beneficial for the program and managing its kind of legacy and outputs and creating more value from its outputs as well. And we've provided a few recommendations around fostering better data connectivity and resolving some of the systemic challenges. Of course, it's not just down to PadSafe. It's not going to solve all of the data challenges that exist in the system, but it can kind of act as a convener and a catalyzer for a bit of a step change in that space as well. And then lastly, some recommendations on, building a legacy for PadSafe for integration to the wider policies and programs. And I know a lot of this work is already afoot and ongoing as well, with lots of business cases being developed. But this is kind of a snapshot whirlwind tour of some of the findings and things that we've uncovered over the course of the evaluation. And like I said, some of this will feel a little bit dated because this was done a few months ago. And that's the challenge of running an evaluation and a program at the same time. There's always a bit of a lag. Next slide, which is the last slide, just to talk you through next steps in terms of what's going to happen next for the evaluation. We are going to conduct the final aspect of the process evaluation, which is basically just updating the data that we've already collected with additional documentation review to look at the progress that's been made, conducting another set of interviews where we've already reached out to quite a few of you on getting a bit of an updated state of play situation and conducting some case studies that can kind of exemplify either really good practices or areas where we can learn from in terms of why things went wrong or didn't quite work as we'd expected, so that it can act as a really wide learning opportunity for the program as a whole. And we're also planning some workshops. And then the outcome evaluation is where we're going to be collecting new data from documents and doing desk research and further interviews and case studies, as well as workshops with end users and strategic stakeholders, assessing the extent of outcome delivery as intended by PadSafe, with the caveat that as the program's finishing in March, a lot of these things wouldn't have come to fruition. So we'd be looking at indicators to kind of give us a sense of, is this likely to happen? How will it happen? And yeah, that's it. I'll stop talking now and see if people have any questions or clarifications.
Thank you very much, Sana, for running us through that presentation. I've got the Q&A up. I can't see any in the sidebar, but if anyone does have any questions, please feel free to either drop them in there or come off mute and mention your question on the call. Hey, Shona, I think, yeah, your hand was first.
Oh, I was just going to start the ball rolling, but I think actually if Sarah has a question, would you want to go for that question first? Because mine is more of a generic talking about the impact
just
usability.
A quick question about the systemic issues around data sharing. We've got another 6 months of the programme left. Is there any way of trying to better engage in that area and come up with solutions? Because I have to say, it's something that has caused a lot of difficulties for a very long time, and it would be really nice if the programme was able to somehow find some sort of opportunity for how it can be done in a better way going forward.
I mean, I think I can talk about it from an evaluation perspective. So I'm not a data scientist and I wouldn't know the nitty-gritty of data sharing and the challenges that are experienced by the community, but I can imagine it's heavily frustrating. We have provided some recommendations, whether they are actionable or feasible, that would be down to the wider kind of PadSafe community to kind of think about whether that can happen. But, I would say in the recommendations, suggestions like leveraging the data advisory groups and community of interest expertise and doing things like hackathons, etc. Again, it comes down to whether there is the appetite and the feasibility to actually bring those kind of activities and conduct them. But I think there are, given that PadSafe is so cross-sectoral, and it has the right people. And I think it's about connecting up the right people and having those right conversations to say, these are the issues that we have diagnosed, and this is how we can kind of get over them. So there are some recommendations to that effect, but it would be down to the program to kind of transact and think about how this could play out.
Okay, thank you.
And Sarah, if I can add to that as well, I think that's an immediate strand in workstream 1A of the programme, which is developing the data system. So we're kind of working very hard in the background, trying to get the right people into the right rooms to have those conversations alongside the recommendations that Sana has proposed, which are the kind of more wider systemic persistent issues and how we can enable these conversations across government. We have a dedicated stream in workstream 1A that's very much focused on the PadSafe system and trying to provide some exemplars, I think, within this pilot nature of a program as well. So yeah, we can bring you up to speed on all of those bits and pieces.
So I've been involved in that one, and I think that the barriers are the problem. Everybody is saying we need to bring all the data together, but the barriers are almost bigger than the scientists. That's the problem, because essentially everybody wants to do it. It's the legal barriers, the confidentiality, all those sort of things, which I sort of feel we need different people, lawyers, data protection experts, etc., coming together and coming up with a strategy that will meet all of the requirements for bringing together One Health data. And it's the same for any bringing veterinary, food, human data together. We have the same challenges every single time, but it's not solved by the scientists.
Yep, absolutely, totally agree with all of that. So yeah, we're pursuing all of those avenues, I think, in the background, in that. And we've got our end user group in workstream 1A, which are the scientists kind of describing what do we need. But as you say, there's so many other parties involved in actually unpicking what those barriers are and how we can move them forward. So delighted to hear that we're all talking from the same hymn sheet, but maybe not so much that we haven't found a solution just yet. But it is on our radar to try and see if we can unpick some of these and use PadSafe as an exemplar of what we can really achieve if we can break down some of those barriers. Thanks, Sarah.
Great, thank you. I think, Jackie, you were next.
Yeah, I wasn't going to come in, but I think Sarah's just kind of probably opened up the real kind of critical issue with this whole programme, really, and she's totally summed it up. It's the big issue with all of this, and I feel that what has been missing perhaps from the programme, and it's through no fault of the programme, because we were under enormous pressure in terms of resourcing and time that I think restricted our ability to do this. But I think what's been missing is the really strong linkage to policy through all of this, and how all of this work, to articulate very clearly how it links through to the parallel policy discussions that are taking place at the moment on One Health and biosurveillance, because it's very clear to us, but I think we've maybe missed an opportunity to make it very, very clear to the policy leads in these areas. And that would have helped, I feel, to break down some of the barriers, particularly between the kind of One Health contributors and the public health part of it, because that's the linkage that's the most problematic linkage in terms of data sharing. And that's what this should be all about, because the end product of this is about protecting public health. And it comes back to, the point there about the engagement and the limited utilisation of the communities of interest. I think, again, what's been lacking there, that could have maybe been strengthened through saying, right, okay, this community of interest is in place to support government strategy for wastewater monitoring. going forward, because it had the right group of scientists and technical experts around the table. And I know, and you'll know yourself, Shona, as well, you'll have been involved in discussions at the policy level, which are looking at this. And I think there's maybe an opportunity for bringing some of that together.
Sorry, I can't get off mute. Sorry, I thought I was off mute. No, absolutely. I think it's all incredibly valid points, Jackie, and thank you for making them, because it is true that there's so many facets here and there's so many different people involved in trying to bring all that together. But we still have opportunity. I think we still have a bit of the time left in the program, and capturing all of that within the process evaluation, and having that information there, and having this information like in these types of forums really helps us move all this kind of stuff forward. So thank you for that input. And I think, yeah, absolutely agree with everything. And let's see if we can try and enact some more of that policy engagement to try and move that forward, and kind of tick the various boxes of buy-in, I think is essentially what we're trying to achieve with a lot of the work that we're doing here.
Okay, thank you both. And Tamsin, did you want to come in?
Yeah, thanks. I just want to chime in with a bit of consensus as well. I totally agree with everything that Sarah and Jackie was saying, and I think we should. It would be really useful to, in particular, have that kind of lack of policy involvement coming through. I think that's something that I think we're within the PathSafe program. We're all very focused on the data challenges, and we know that and we recognise that, and to capture some of what Jackie's just said, I would just like to underline, because I think that's an issue that cuts across a bunch of different initiatives. But I also just wanted to emphasise, I think with respect to the data issues, the legacy of PathSafe in terms of feeding into ongoing cross-government work in this area. I'm thinking about the National Biosurveillance Network specifically. But obviously, in the next 6 months, while people are trying to conduct analyses and write up reports, and we're not going to get that cross-cutting, solving all the problems of data sharing within government. But the recommendations that come out of PathSafe that then can feed into things like the NBN, I think is an important legacy, because it is a really important kind of block in that process.
Absolutely. I think I totally agree with what you're saying there, Tamsin, and there's real opportunities here for us to maintain the links that we've developed and continue to pursue those wider links as well. So I think that there's connecting at kind of the program level, but also, as been mentioned by other people on the call, connecting at that individual level here with the influential people who are going to be making decisions or who can influence the policy positions. I think we're not the first people who've come up and said this is a really hard task. And we were very ambitious in our bid and will continue to be ambitious, but it may be that we will not solve all of the data issues. That would be the dream. But what we're trying to do is move towards that position where we can show what can happen if we do end up in a position where we find ourselves being able to share the data. And I think all of the kind of sentiment that's expressed today is all very real for the program, and we'll move that forward. And this is the huge benefit, even though, as Sana mentioned, it's very, very difficult to do an evaluation while a program is still running because there's so many moving parts. Getting this interim position and hearing about where we can maybe start driving additional focus, I think is incredibly helpful. So thank you very much to Sana and Pimi and the team for bringing all this through, and all the people who did input into all of the interviews and everything that's happened so far. It really helped us focus the minds on the bits where things are going well. That's brilliant, but how can we tease out these additional areas that people are really crying out for?
Perfect. And Robin, do you want to come in?
Yeah, thank you. It's on a similar theme, unfortunately. Sorry, I'm sure you want a question on something else. Just to round that off, Shona, this is more for you really, but I think the evaluation and the final evaluation, obviously, when it's more detailed, seems like it will be quite a powerful message to play back to Treasury about some of these systemic challenges. And if the whole point of the Shared Outcomes Fund is to get government departments to work better together, but we're completely hobbled by some of these systemic features, I think we need to sort of make that case very strongly back to Treasury, because as I think Sarah said, it's not for us to be scrabbling around doing individual little data sharing agreements and things like that, where it probably needs more of a strategic, systemic fix.
absolutely and totally agree, and it's going to form part of, I think, our continuation bid as well, in the sense of we have more opportunities to work here on this if we're given a bit more time. Equally, we've been in contact with several other programs who are doing data type work, and even one that's working out of the ONS, where they're dedicated to breaking down some of these barriers and things like that, and they're coming up against similar issues to what we are. So we're not alone, I think, in our pursuit of this, which is really positive. But we're also not alone in the same barriers that keep cropping up. So I think a very powerful message, as you say, Robin, coming out of this program is actually the Shared Outcomes Fund is exactly what it says in the tin. We should have shared outcomes, but if we're being blocked in our ultimate aim to achieve that, you know, that's something that we should be reporting back into the likes of HMT, who can support some more funding in this area to try and have dedicated projects who break down those barriers. But equally, the round 3 SOF programs that have been funded, a lot of them have significant data elements in them as well. So there is an element of continuity that we're seeing through round 1 and round 2 and round 3, in that they want to break down the data barriers. But have we been able to do it in the first 2 iterations? Will we be able to get it sorted by the 3rd iteration? I think there's lots of question marks there for the wider SOF evaluation, which we'll read in earnest when it happens, but I think that's going to be a while before we see that coming out.
I think that's a really important point, again, if I may chime in, that Robin's just made, right? So that's why even at this kind of interim stage, the recommendations that we've put forward are not just for the PathSafe program team, they're for a wider audience, because really some of these things need to be resolved at that level. And the challenge around kind of policy and central government linking in does emerge. And I think it's kind of almost organically now becoming the focus of the program in terms of making those links and connections to resolve some of the systemic challenges, but also to raise the profile of PathSafe, because it might have started out as, oh, let's do this exemplar program, but almost maybe a victim of your own success, where it's like a really strategic program because it's come around at the right time. And it's kind of a cog in this wider machinery of like biosurveillance initiatives that are ongoing when the release of the strategy. So I think it's just become a lot more strategic very rapidly, which means that some of those connections now need to be forged quite rapidly, almost retrospectively in some respects. So I think all of those things are emerging through the evaluation and these conversations as well. So it's a really helpful point. And I think it would be really great to kind of utilize this kind of community of experts in almost crafting a very granular set of recommendations. So we come in with more kind of high-level recommendations, but then crafting more detailed recommendations to those wider communities of interest and strategic stakeholders to make sure that that is kind of like a good, powerful legacy of the program.
Jackie, did you want to come in?
Yeah, it was just to follow on really and to agree very strongly with the points that Robin made, that it has to be a real take-home message to Treasury. And it goes back to the policy point. There is a real drive across the UK for One Health strategy. And we've found in this short-lived research project the stumbling blocks that are in the way from us being able to implement that in practice. And a lot of the issues that we experienced through PathSafe, it was almost between partner organisations, all of whom publicly make a commitment to signing up to a One Health ethos across government, yet for some reason the rules and regulations in their organisations require us to set up all of these data protection issues over samples that are actually shared across government. And you know, I was finding myself having to sign confidentiality agreements for samples that I had generated because the organisation that was analysing them had their own rules and regulations that they had to go through. And I think a very strong message should be going back to these organisations that actually they won't get funded for research unless they have a more open system for enabling the sharing of data to facilitate this work. Because I think it's been a very, very serious issue as part of this project. And I think as part of the evaluation, I think I fed back during my interview on the evaluation was the amount of resource that we were having to expend in this project through administrative tasks, writing these agreements and toing and froing between data protection, legal departments and contract departments, all of which at the end of the day, when you look at the products that we're producing, just seemed completely over the top, you know, looking at what, you know, the protections over the data that we're generating. So I think that's something that does need to be looked at as a real learning point from this.
Absolutely, that disproportionate feeling of the routes and processes that we have to go down that ultimately end up either coming to fruition, we spend an awful lot of time and money getting them moving forward, or they become an ultimate blocker where you just kind of decide it's in the too hard box, it's not possible to get this done in the time. Jackie, I think all that feedback is so useful. So hopefully you'll have seen some follow-up interview requests coming through from the evaluation. So capturing all of this would capture the information today, but equally anyone that's on this call and wants to feed back information into the evaluation would be very much appreciated. And also just to make people aware of an event that we're running on the 14th of November in Birmingham. So if you haven't seen this information previously, do get in touch with us because we have spaces left at this event. And the RAN team are going to be helping us run some workshops. And one of the workshops is going to be very much focused on what are the barriers to cross-government working in the One Health arena. So not specific to PathSafe, we're looking across the biosurveillance sphere really to bring in all of these other programs that are working in this space to see if we can pull from each of the programs, what are these barriers? You know, PathSafe have identified barriers, but NBN, the BSS projects, all these different projects might have similar experiences, but equally more experiences that we want to bring all together and to create this narrative actually of what's preventing us from getting there. And I think, Jackie, you're totally right. People across government, organizations across government have signed up to this concept, but actually what's underpinning and what infrastructure do we need in order to get that enacted, I think is a key output that can come from the PathSafe program. And it's a legacy item that we can pull into continuation, but regardless of continuation, we have that opportunity to kind of really showcase what we've been able to achieve, but actually what have we come up against in that achievement. And as you say, it's a relatively short-lived program as well, you know, so it shows us with dedicated effort what can be achieved, but actually be a lot easier if we didn't have a lot of these barriers coming through. But yeah, it's just that kind of, I suppose, reiteration of that this information is so valuable for us to capture. And yeah, thank you to everyone who's been inputting so far, and we continue to seek your input, I think, on the evaluation front, and make sure that we're gathering kind of these concerns and opportunities as much as possible. So just on the 14th of November, if you haven't seen information about that event, but you are keen to get involved, said it's in Birmingham, it's a full day event, and it's a biosurveillance themed event as opposed to just PathSafe, do let us know and we can extend the invite out to people as needed.
Thank you, Shona. Is there any other questions in the room? Can't see any hands up. I can't see any in the Q&A. So I think I'll wrap up there. So thank you very much, Sana and Pamina, for attending today. I think this has been a really helpful presentation and helpful discussion as well. And thank you so much to our attendees and for a really great contribution and discussion just now. So just as a reminder that further information, including recording of this webinar and previous webinars, can be found on the PathSafe website. And please do contact pathsafe@food.gov.uk if you'd like to be added to the PathSafe mailing list for our newsletters and any future webinars as well. The next webinar that we have scheduled is on Thursday, the 9th of October from 2 to 3 p.m. And this is the Genomics for Animal and Plant Diseases Centre 2 webinar. So if there are nothing else, I will wrap it up there. Thank you very much, everybody, and I hope to speak with you soon.
Thank you.
Bye.
Thank you.
Bye.